A critical reassessment of daily hygiene practices is currently underway within the fields of geriatrics and dermatology, challenging the long-held cultural assumption that daily bathing is universally beneficial, particularly for individuals over the age of 70. Prevailing societal norms, largely shaped by 20th century marketing rather than medical science, have equated frequent, full-body washing with optimal health. However, a growing body of clinical evidence suggests that for an aging population, this very practice may systematically undermine well-being, introducing a cascade of dermatological, immunological, and physical risks. This analysis will synthesize current research to present a new, evidence-based paradigm for senior hygiene. We will explore the profound physiological changes in the integumentary system after age 70, examine the significant systemic risks posed by overbathing, and detail the science behind the body's sophisticated, self-regulating mechanisms. The objective is to provide a clear, authoritative framework for a safer, healthier, and more scientifically informed approach to personal care in later life, replacing outdated habits with strategic, individualized protocols. The dermatological consequences of overbathing, the compromised epidermal barrier. The skin of an individual over 70 is fundamentally different from its younger counterpart. A 2024 longitudinal study published in the Journal of Investigative Dermatology from the University of California, San Francisco, details these changes at a cellular level. The epidermis thins, cell turnover slows, and the production of collagen and elastin in the underlying dermis decreases, leading to reduced structural integrity. Concurrently, sebaceous and sweat gland activity diminishes significantly. This results in a sharp decline in the production of sebum, the natural lipid-rich oil that forms the skin's protective, waterproof barrier and maintains its acidic pH, the acid mantle. Daily bathing, particularly with hot water and alkaline soaps, systematically strips away this dwindling lipid layer. Hot water emulsifies and dissolves these protective fats, while harsh detergents disrupt the acid mantle, leaving the skin vulnerable. The immediate consequence is xerosis, abnormal dryness, which manifests as tightness, pruritus, itching, and visible flaking. Over time, this can lead to the formation of painful fissures and cracks, creating portals for infection. Increased risk of infection and inflammation. The microscopic tears and compromised acid mantle caused by overwashing create an environment ripe for opportunistic pathogens. Research from the New England Journal of Medicine has established a direct correlation between reduced bathing frequency and fewer skin tears in older adults. These tears, which heal slowly due to age-related decreases in circulation and immune response, serve as entry points for bacteria like Staphylococcus aureus or Streptococcus. This can result in serious localized infections such as cellulitis or, in severe cases, systemic infections like sepsis. Furthermore, the disruption of the skin's barrier function can exacerbate chronic inflammatory conditions like dermatitis and eczema. The very act intended to promote cleanliness can, paradoxically, foster a state of chronic inflammation and increase immunological vulnerability. Systemic risks and physiological strain. Fall risk. The bathroom as a high-threat environment. For older adults, the most acute danger associated with daily bathing is not dermatological, but physical. According to the UK's National Institute for Health and Care Excellence, NICE, falls are the leading cause of fatal and non-fatal injuries in the senior population. The bathroom, with its wet, hard and slippery surfaces, is one of the most common locations for these incidents. Daily bathing multiplies exposure to this high-risk environment. The physical act of bathing challenges an aging body's compromised systems. Age-related decline in proprioception, the sense of body position, muscle mass, sarcopenia, and slower reflexes make balancing on one leg to enter a tub a hazardous maneuver. Furthermore, the heat from a shower can induce vasodilation, leading to a sudden drop in blood pressure, orthostatic hypertension, causing dizziness and disorientation at the most critical moment. Reducing bathing frequency from 7 times a week to 2 or 3 times is a direct and highly effective fall prevention strategy, reducing high-risk exposure by over 50%. The threat posed by a fractured hip or traumatic brain injury from a fall is exponentially greater than that of infrequent bathing. Cardiovascular strain and energy depletion. The concept of homeostenosis is central to understanding the physiological impact of bathing on seniors. As detailed in publications like The Lancet Healthy Longevity, homeostenosis refers to the narrowing of the body's physiological reserves with age. An activity that is trivial for a younger person, such as standing in a hot, steamy shower, can represent a significant cardiovascular stressor for an 80-year-old. The body must work harder to regulate temperature and blood pressure, taxing the heart and lungs. For individuals with pre-existing conditions like COPD or congestive heart failure, this can lead to profound exhaustion that persists for hours. Conserving this finite energy by reducing bathing frequency allows for its allocation to more vital activities such as mobility, nutrition, and social engagement, thereby improving overall quality of life. A new paradigm of hygiene, working with, not against, the body, the self-regulating skin microbiome. The skin is not an inert surface, but a dynamic ecosystem populated by trillions of microorganisms known as the skin microbiome. Research from the Center for Microbiome Research at the University of Pennsylvania has shown that a diverse and balanced microbiome is essential for health. Commensal bacteria, such as Staphylococcus epidermidis, actively protect the body by outcompeting pathogenic invaders and producing antimicrobial peptides. Aggressive daily washing causes dysbiosis, an imbalance in this microbial community. It indiscriminately kills beneficial bacteria, allowing potentially harmful microbes to proliferate. By reducing bathing frequency, we allow this protective microbiome to remain stable and functional, leveraging the body's own sophisticated self-cleaning defense system. Expert recommendations and the Strategic Hygiene Protocol. Reflecting this body of evidence, leading medical bodies, including the American Academy of Dermatology and the British Geriatric Society, now advocate for a shift away from mandated daily bathing. The consensus recommendation for many older adults is full-body bathing once or twice per week, with frequency adjusted for individual factors like activity level and health status. This approach is supplemented by a strategic hygiene protocol that maintains cleanliness and dignity without the associated risks. Targeted cleansing, daily use of pH-neutral, pre-moistened wipes or a soft washcloth with a gentle no-rinse cleanser on key areas, underarms, groin, face and hands. This removes sweat and odor-causing bacteria without compromising the entire body's skin barrier. Consistent hand washing. Meticulous hand hygiene remains the single most important practice for preventing the transmission of infectious diseases. Oral care. Rigorous daily oral hygiene is critical as it prevents local infections and reduces systemic inflammation. Clothing and linens. Daily changes of undergarments and frequent changing of clothing and bed linens are essential for removing bacteria and maintaining a feeling of freshness. Redefining cleanliness for longevity and well-being. The transition away from ritualistic daily bathing for seniors is not a reduction in hygiene standards, but an elevation of them. It represents a move toward an intelligent, evidence-based model of self-care that is tailored to the specific physiological realities of aging. By prioritizing the integrity of the skin, minimizing exposure to physical hazards, conserving vital energy, and respecting the body's natural defensive systems. This modern approach offers a pathway to a safer, healthier, and more comfortable life. The ultimate goal is to redefine cleanliness, not by the volume of water used, but by the overall state of health and well-being that our hygiene practices support. This information can be crucial for an individual's health strategy or for those caring for aging loved ones. We encourage you to discuss these findings and share this knowledge to help foster a more informed and scientifically grounded approach to geriatric care.